Hello, my name is Mokoma Kalumba. I would like to tell you about a new application on the Global Health Network called SiteFinder. The idea behind SiteFinder is that we know there are lots of research sites in developing countries that are very well equipped, have excellent staff and facilities, but struggle to make themselves known to potential collaborators. We often hear from research groups who are frustrated that they lose excellent staff members when they are between grants because they have no funding to tide them over between studies. Similarly, there are many healthcare professionals working in standard care settings keen to get involved in research, but who do not know where to start. On the other hand, there are lots of people planning studies who are looking for research sites to work with, but there is no easy way to find research sites in developing countries. These people planning studies could be from universities across the world, or they could be from industry, such as contract research organizations or pharma companies. There could be product development partnerships or charitable organizations, or simply could be nearby research sites who are keen to collaborate with other research sites on studies. The fact that there has never been an easy way to link these two groups has often meant that collaborators planning studies only stick to using certain research sites for certain disease areas. Therefore, there are lots of research sites which have only worked on one disease area but could easily diversify and are keen to do so. If research sites had access to more studies, this would also mean that experience and skill set of the site would be increased, and the sites could also have the means and experience to run their own studies into local health issues. This would help drive more evidence to improve health outcomes in developing countries. The idea behind SiteFinder is that it will bridge this gap by bringing together research sites who are keen to collaborate with people who are planning studies and need to find new research sites to collaborate with them. SiteFinder has been launched in June 2013 and already has many research sites and studies signed up to it. It was built with funding from the Gates Foundation and after extensive testing with research sites and a working group made up of members from international research organizations. SiteFinder is one of the applications on the Global Health Network, which is a platform for exchanging knowledge, sharing research methods, and facilitating collaboration among global health professionals to fuel faster and better evidence to improve health. Everything on the Global Health Network is free and open access, and anyone can join. It is made up of communities of practice led by research groups across the world, and you can use it to find hundreds of resources, guidance articles, news and event items, shared protocols, regulatory information, expert advice, blogs, discussion boards, e-learning, and a professional development scheme. This is a SiteFinder homepage. You can see the grey button at the bottom, which lets you access the rest of the Global Health Network. When you sign up to SiteFinder, you can automatically choose to extend your membership to the whole network or any of its sub-areas so that you can benefit from all these features as well as SiteFinder. SiteFinder and indeed the whole network is completely free and always will be. We already have many sites and studies signed up. To find a study or a site, you just click on the relevant buttons in the middle of the screen, or you can add your own. Also, you can register or log in using the buttons at the top of the screen. When you're looking for sites or studies, you can see there are the two tabs for each. You can search by disease area, location, or type of facility, or you can use the advanced search to combine all the features. A research site who signs up could be a large and well-known institution like the Kenya Medical Research Institute sites in Kenya, but it could also be a single research professional keen to take on their first study. If you browse through SiteFinder, you will see a great variation in the types of sites and studies involved. When you click on a site, you can see the information that site has added about themselves. When a site joins, they can add as much information as they want, and also pictures, videos, training documents, audit reports, etc. Sites can edit their information at any time, as often as they want. Collaborators can contact the sites using the messaging system at the bottom of the page. When sites sign up, they also automatically have access to our monthly emails, which give information about grants, training initiatives, and news across the world. We also distribute support documents about how to promote your site, respond to collaborators, expert advice on audit and monitoring findings, and so on. So by signing up, the sites gain access to a lot of information as well as promoting themselves for new studies. This is an example of searching for a study to be involved with. When a new study is posted on SiteFinder, the website automatically tells other sites that are relevant to that study in terms of matching the disease area, facilities, and location criteria. Then the sites can choose to put themselves forward for that study if they are interested in taking it on. The whole messaging process can be done using SiteFinder's messaging system, so it's completely secure. It's really easy to add a research study or site, and as I said, you can edit your entry at any time. To add a study or site, just click on Add Study or Add Site from any of the pages, then fill in all the information. There is a live help desk available on weekdays. You can just add us on Skype and use the instant messaging function, or contact us using the help desk email. We are happy to provide any support necessary and answer your questions. When people post studies, they can also adapt the information required from the sites. For example, if one study particularly needs to know about the disease prevalence in the site's local area, they can use the Adaptable questionnaire when entering their study to automatically ask this. To edit a study or a site, all you need to do is log in, then click on your profile. This will be your name at the top of the screen. Then you can click on My Site or My Study and edit. You can also use this function to track the number of responses to your study or site, and then use the messaging system to contact people. We are really keen to encourage researchers to put forward their sites and studies on SiteFinder, and to use a global health network for support in running those studies. We would especially like to invite any research groups who are planning studies, even at an early stage, to post their plans on SiteFinder so that collaborators can then get in touch. You don't have to have your protocol completely finalized to sign up. When you have used SiteFinder and got that increased diversity of the research sites involved, planned studies might be improved and completed faster. Please do get in touch with us with any questions that you have. Thank you for listening.